So my name is Dharanka. I'm one of the neurosurgical doctors at the Royal London and a volunteer for UK Youth for Nature. Thank you very, very much for tuning into this webinar, which will also be on YouTube in due course. I just wanted to introduce Professor Michael Eddleston from the University of Edinburgh. He is a world-renowned toxicologist and clinical pharmacologist who has an extensive background in the history and the understanding of pesticides in not only a health context, but in a public health context. So he's not only done extensive research onto the impacts of pesticides on the human body, but actually has now joined the UK Expert Committee on Pesticides to understand and regulate their actual utility in practice. So without further ado, Professor Eddleston, thank you very, very much for joining us. Your list of achievements is quite outstanding. Like even for a medic in particular, if any medics are listening to us, we're very familiar with Oxford handbooks when it comes to our revision. But somebody who's actually written an Oxford handbook, so the Oxford Handbook of Tropical Medicine, I think it's a great honor to actually be meeting somebody who has contributed so much, of course, to our education in due course. But enough about all the introductions, I'm sure. What I guess I'd want to start by asking you, what kind of work are you doing at the minute? And especially just in relation to pesticides, and what do you feel is worth shining a light on? And we'll go from that to your personal interests through to some specific work you've done and what we can do for the future. Is that all right?
Absolutely. So thank you very much for inviting me. I hope I can respond with interest to your questions. So I think in terms of research-wise, what I fundamentally hate is people dying. Premature deaths upset me. I still, even to the day, I cry when I give lectures sometimes. So 25, 30 years on after I saw those first patients, it still distresses me when I'm doing my work. And I think there are multiple ways of working to stop people dying. I'm not trying to stop people self-harming. Someone told me the other day, actually, there are 3 levels of suicide prevention. One is to stop people getting to a position where they may self-harm. There are ways of trying to prevent that self-harm being dangerous. And then actually, that's kind of effectively what I do. I try to make sure self-harm is not as dangerous as it could be. And that's about making pesticides less toxic. So the ways you could do that is by working with patients. So I try and do clinical trials to find better ways of treating people. And the trial I've just finished is one called Sisi Bok in Bangladesh, which is run by my Bangladeshi colleagues, in particular Rabi Chowdhury, Aniruddha Ghosh, and Abul Faiz, to work out whether calcium channel blockade could improve the care of patients with organophosphorus poisoning. Unfortunately, the answer is no. We've been told by the data monitoring committee the study is now stopped, the analysis is happening, but fundamentally the new treatment doesn't work, which is a real shame. But actually, perhaps not too big a surprise. It's really difficult to care for patients who have ingested pesticides in moments of stress. They're medically very complex patients, and they're coming into hospitals which are not the world's most resourced hospitals. Often they're in rural areas of the world, and they've not got lots and lots of intensive care beds, et cetera, et cetera. But even with that, they're difficult to care for. So the second level we've been working on is the communities. Can we change how pesticides are used in communities? And for a long time, industry has said, well, actually, it should be safe storage. We should be using pesticides safely. It's a little bit like the analogy of guns. Guns don't kill, people do. But if the person didn't have a gun, the person would find it an awful lot more difficult to kill someone. It's a little bit similar with pesticides. The idea of pesticides are not toxic, it's how people use them. But these are extremely toxic compounds. And in the 1960s, with the Green Revolution, with new strains of plants, with fertilizers came along pesticides. And those pesticides were lethally toxic. And actually, the shocking thing to say is that 4-8, which came out in the 1960s, is as lethal as sarin nerve agents. So this is a little bit like going around to your house and saying, here's the bottle of sarin, store it in your house, make sure no one's around and drinks it when they get stressed, no one spills it on their skin. Just be careful with it. And that kind of how it's been over the years. The WHO and regulators have removed many of the really toxic pesticides. So 4-H, for example, was finally banned in 2018. But until that point, you could go to a shop and buy 4-H and use it and store it at home. So this idea that we could store pesticides as toxic as this in our houses and use them safely is, to me, a major fallacy. A colleague of mine just wrote a beautiful paper called, the fallacy of misuse. Don't blame the farmers. These are compounds that cannot possibly be used. However, so as a result of that, we did a trial to work out if we store pesticides better in a household,
Mm.
can we stop self-poisoning? And this was a huge study, 53,000 households, 223,000 people were randomized in the north central province of Sri Lanka to either
Mm.
get a really nice container for their pesticides or not. And the design of the pesticide took years. It was done in consultation with the villagers who came up with the ideas of what we could do. And we finally came up with this plastic container, really thorough, really sort of robust. It would go in the ground. And the elephants are the only thing to destroy. If the elephant stands on it, it got destroyed. Other than that, you're pretty safe. So this is a good place to store it. And we found that at 2 weeks, 98% of them had them in the ground. We went and helped the people who hadn't done. And then we went to 1 year and 75% of people were using the boxes and storing them pesticides in it and locking them, which is pretty good. And at 3 years, it was 50%. So we know this approach was kind of working as it was supposed to. People were putting pesticides in their boxes when they could do, but it made absolutely zero effect on pesticide poisoning. There was no reduction at all in cases of pesticide poisoning as this approach, because the people who were poisoning themselves, which is a minority, clearly didn't think of this as a priority. So this active form of regulation didn't work. The study we just finished now was a really beautiful study set up by Manjula Veerasinghe and supported by Melissa Pearson as the trial manager, was a study of can we work with pesticide vendors, people who sell the pesticides to people in the community, without a prescription, without any instructions. They often have a discussion with the farmer, say, well, I think this one's a really good one to use. Why don't you use this one? And we said to them, can we help you not sell it to someone who's going to drink it? Because, and we found out that 75% of people who bought the pesticide for an act of self-harm were either intoxicated, were showing strange behavior, or knew nothing about farming and clearly didn't need the pesticide for farming. So that study went on over 5 years. It was a population of 2.4 million people. He trained 1,400 pesticide vendors and about 850 shops over time. So they all got done in what's called a step wedge design. You start off with a small area and gradually over time, random areas of this area, people get trained in.
We don't know like with a pie chart almost, you're having them slowly filled
exactly.
in.
And those are filled in at random. So we don't know which ones do. We can then see, did having that training make a difference on people in that area over time? And that analysis will come out. It's hard to be very confident. This is the first ever proper size trial of gatekeeping. Can you do suicide prevention by trying to screen people? So school keepers are supposed to be trained to be gatekeepers, or a gun owner, a gun shop owner, or people who have charcoal. So that trial just finished. It's very exciting. The analysis will happen soon. Do I think it's going to change the world? No. What is changing the world and will change the world is simply removing those toxic pesticides in communities. This is the third level of work. It's working with regulators worldwide. So each country, there's a department like HSE or like CRD in the UK, where pesticides are regulated. And there's a decision, do we want these in this country? And that's a bit about needs. Unfortunately, in my perspective, the actual evidence that we need pesticides is extremely weak. There's never been large-scale studies to show holistically, do you need pesticides in these communities versus natural predators versus natural pesticides, biopesticides, or even nothing.
So that's actually very surprising to hear. That is very, considering how ubiquitous pesticides are, you'd think some robust.
So 20 years ago, I sat down with 4 Syngenta employees and said, what is the evidence that I should be using pesticides? And their response was obvious. You need pesticides. So I said, well, it's not actually that obvious. Clearly, if you take 2 strips of land and you treat one with pesticide and one not with the other, and you have pest in both, and you introduce the pest, then you will get a reduction in yield. Now, is that reduction in yield damaging? If you got rid of pesticides and used natural predators and you mixed your crop and didn't do monocultures, and you can actually do multi-cropping, what happens then? And they didn't have an answer. And so at the end of the meeting, they said, well, find something. And about 2 or 3 weeks later, I got an email with a single paper. And that single paper was a study done in Denmark where they randomized, or whether randomized is the right word, 2 farms. One farm to have no pesticides and one farm to have small amounts of pesticides, done very carefully, really analytically done how much pesticide you need. So completely different to the small holding farmers across the world who are using a lot of the pesticide. I'm not sure it's all of it, but a lot of pesticide and a lot of the problems occur in smallholders. And that showed that using a small amount of pesticide in a very intelligent way was cost effective and reduced costs. I don't remember about the yield now, but it was definitely slightly cheaper. But that was the only evidence. The study was probably, well, I got the data in 2003 or 2004. The study was done in the 1990s, but a single study was what they could bring up, where it was even a single farm level. What I wanted to do in the 2000s was do a study in Sri Lanka and randomize the whole of Sri Lanka to use pesticides in some districts, not in others. But what I found at the time in those discussions was that the agricultural regulators were not used to receiving that information. They wouldn't know what to do with it. We're trying in healthcare now to do randomized control healthcare studies to come up with the answer. For example, should we be providing safe storage devices in Sri Lankan villages? The answer from the data is no. But that kind of study being done in agriculture simply hasn't been done for pesticides. And if you look at all the modeling that's been done worldwide now, as far as I'm aware, they don't even take pesticides out of the model. They're in permanently, because as far as the world is concerned, you need pesticides. But when you actually ask the evidence, there's really very little there.
So
and interesting from one of my colleagues just said, so I keep talking, is that if you actually treat some plants with pesticides, they become more attractive to pests. And actually pests then cause more problems in that. And that's separate from resistance. Clearly, if you use too much pesticide, you can get resistance growing. This is a separate point that actually giving pesticides makes the plant more attractive to pests. That's a disaster.
That is absolutely wild. That's like, you know, those cases where they'd introduced the mongoose to get rid of rats, except the mongooses and the rats would like not be active at the same times of day. So you'd actually just get your indigenous animals kind of getting killed, whereas the target animal for the treatment, shall we say, just kind of just continuing to reproduce unabated. It seems like the same lapse of logic that's essentially coming about because of a received wisdom and nothing else. So that is
well, received wisdom with a heavy lobbying force behind it.
Yes.
So that's where the commercial determinants come in. Is that, you know, pesticide industry have a duty to their shareholders to make a profit. They make a profit by selling a product. They can't sell a product unless there's a need for the product. Therefore, there has to be a story that there's a need for the product. And when you start asking the question, well, actually, what's the evidence for that need? It's really very weak.
Wow, that is extremely interesting to hear, Professor, and it's so useful to kind of hear the expert perspective on this, because as a lay member of the public, or even a medical member of the public, you hear about the after effects. You hear about, you're taught about the impacts potentially of pesticides on health, but you're told that potentially there might be a bad thing, and that organic as an option might be better, but the comparative evidence is almost never mentioned. The context is almost never mentioned. So I'd like to hear on a grand scale, effectively, that the evidence seems to be actually rather weak, or at least not particularly well. There's hardly any papers actually doing the comparison, presumably because it's so onerous to do it for reasons you've described in terms of your trial, because of how
it is onerous. It takes 7 to 8 years to do one of these studies. But at the same time, I don't think anybody wants a study to come out and say we don't need it. So unless you've got people who's come from a mentality of doing these kind of trials, which is a public health perspective, you don't do it. So while I say there's only one paper I was told about, I had a conversation last week with someone from Bayer, a clinician from Bayer, and she is a huge believer in pesticides and really believes we need these pesticides. And has sent me 2 emails with a flurry of papers. But at some point in the next few weeks, I have to sit down and go through all her papers and try to analyze them and work out if I was making public health policy based on this data, would I believe it enough to go ahead and change policy? So that's my task for the next few weeks.
Wow, that's certainly very important work to be getting on with, and I certainly very much look forward to kind of hearing the results of it in some respect, Professor Eddleston. I think it would be very useful to hear sort of the public health expert perspective on this, especially considering that we often hear, in the news that certain new pesticides like neonicotinoids, am I pronouncing it correctly? Yeah. These things are being approved, it seems, or rather, the regulations surrounding them are being relaxed, as I understand them.
Not exactly. Those are emergency. There's a part of the statutory legislation says if there's a new crisis occurring, which requires a banned pesticide, there is a process for a company to put forward that banned pesticide to be used for a particular product, a particular time of year, and a particular crop, and a particular location. And it's quite strictly done. And so those processes are there. You'll tend to come back to, if you want to go into the expert committee of pesticides now, the expert committee of pesticides does not make regulatory decisions at all.
Okay, sure.
It's there only to provide advice to the health and safety executive about their pesticides. So the health HSC do the regulatory decisions, and you can't believe the amount of documentation that comes from the companies to look at these things. I
Mm-hmm.
mean, we see them on computers, and I was someone emailed yesterday. It blew his computer up trying to open up one of these folders. I mean, the scale is huge. HSE have staff to go through that. They've increased their staff since Brexit, because in the past they used to share. I mean, Britain did a large proportion of the European reviews of regulations, but now they have to do everything by themselves. And they want to do it well and efficiently to make sure companies still want to come to the UK if you believe that pesticides are important. So this committee is a setup to offer advice to the health and safety executive for particular questions. At meetings, they say, we're looking at all these documents, there's thousands, but we have 5 questions which we would like your feedback on. So that's what the expert committee on pesticides is. It provides expert views to support the health and safety executive. Now, I mean, for example, some of those, you might in theory imagine where there's an emergency application, the expert committee says no. But still, fundamentally, policy is always made by policymakers, which are really politicians. So then what you'll see is when these neonicotinoids get approved, they're approved on a political basis. The regulatory decisions are often made based on the science, and that are then presented to a government person. And that's right. The policies are made by politicians. And I think what we want is politicians to be really well informed and to have systems in place to allow them to access the data and and information to back up their policies. They may not, and it's their right, choose to follow that. And that's why we have elections.
Of course. I think on that note, then, I guess, given that you've been able to look at, so much data, in terms of the expert committee's kind of input, I guess, what accomplishments from that and what kind of insights would you say have been most meaningful to come out of that? And what might have kind of influenced, just for our listeners, over the years, what kind of has influenced kind of a lot of decision making, from what you've been able to discuss?
So, I mean, I've only been on the committee about 3 or 4 years now, probably 3 years. Okay. I'm still fairly new. People are on it for 10 years. And I come from a very specific background. I was sat on the joint meeting on pesticide management, which is the UN's, again, a kind of scientific committee to give advice on policies for pesticide use worldwide. I mean, I think the regulators done some really important things. If you look, there's 2 things I think are the most important. Again, this is not the expert committee on pesticides. This is the regulator, the health and safety executive, deciding which pesticides should be allowed. So they've removed many toxic pesticides. So, for example, the dipyridyls, the paraquat and diquat have been removed, and there's been a marked reduction in deaths in the UK. I mean, the numbers were tiny compared to places where, smallholders are using. In Sri Lanka, in parts of Sri Lanka, North Central Province, 85% of households have agricultural concentration pesticides in the house, stored every night, or most of the night when they have seasons. So these are really toxic. Even the safer ones are pretty toxic because they've got 40% solvents. If you put that down your lungs, you're not going to do very well. If we come to the UK, maybe only 1 or 2% of the population involved in agriculture. And so only those people have access to these highly concentrated pesticides. And they're generally professionals. They know what they're doing. They do things in a structured way. So the pesticide use here is much more measured than it is in Sri Lanka, for example. What we as the populace, the 85% equivalent here in UK, we can't buy 40% agricultural formulation pesticides. They're far too hazardous. We can only go and buy a 0.1% or a 0.05%, so a much more diluted compound, which is more expensive to make because it's diluted, and therefore you've got to make packaging that takes that big, but it's much, much safer. So the regulators have done a really nice job in terms of just making sure that what we, as a general member of the population, can access is low toxicity. The other thing I think they've done over the years, there's an argument about hazard and about risk. Yes. Now, I'm a clinician. I'm not a world expert on these issues, but my understanding of the two is hazard is an inherent property of the compound, and the risk is how it's used. Clearly, if you have a very hazardous compound, if you can use it very safely, then the risk is reasonable. And this is the industry's perspective, comes back to the idea, pesticides aren't the problem, it's how they're used. So therefore, the industry doesn't like the idea of hazard. They're much more interested in risk. So their view is any compound can be used because fundamentally they don't believe they're hazardous. They believe there's risky use. So you can change the use. Therefore, every pesticide should be allowed. And that's where their safe use activities come on. There's a lot of stewardship put out by the industry. And that's about, they'll say, I trained 100 million farmers to use pesticides safely. So they went on a course and they were taught how to do something. And then no one really went after them and checked they were doing it. and how many farmers, the flux of farmers. You can imagine 10% people give up every year, or 20%, another 10 or 20% come into the farming. So there's a huge flux. And the idea you can train people to use a compound safely, and then even more, that compound is as hazardous as the sarin nerve agent, as was the case with phorate, and methyl parathion or folidol are similarly toxic, is just it's nonsensical. So the European Union and the British regulator, the Health and Safety Executive, take a hazard-based approach initially.
Sure.
Are these compounds hazards? And there's a number of criteria what's a hazardous compound. So if you are a hazardous compound, you will not be allowed to be used in Britain. So that's the first level of swept out. If you tick that box, you're not going to be licensed at all. And then the next question is, if it's not a significant hazard or highly hazardous, and it's a moderately hazardous, can it be used safely in the British context? And the huge advantage Britain has, it has a number of specialists who know about these things and can actually come up with very careful data to say, actually, this can be used safely. And that's about exposure to people in the environment. It's about exposure to people who come back into the fields afterwards. And it's about the operators of the pesticide sprays. Can they be used? Now, that's completely different to Sri Lanka. In Sri Lanka, the marketing department for one pesticide company is bigger than the whole regulatory department. So the idea that the regulators can actually come up with high quality scientific evidence to suggest when a pesticide can be used safely using a risk-based approach doesn't make sense. And also what people are pushing for is to discard the hazard-based approach and say all pesticides can be assessed for risk. Now, the fact that Britain and European Union won't follow that approach shows you that it's really very difficult to imagine how you could possibly use these hazardous compounds safely. So they take this approach, no hazardous compounds allowed. We will only do risk-based approach for safer pesticides. But the world is trying to push, for example, Sri Lanka, to take a risk-based approach for everything. And actually, there's a new legislation passing through law in Brazil to say everything should be risk-based. There should be no hazard-based assessments. And that goes against what are probably the most best resourced regulatory organizations in the world, the European Union and the UK. Clearly, Australia and USA, and I think USA and Australia are very well resourced, their regulators as well, and they actually prefer a risk-based approach. But the fact that European Union and Britain do it to me, is a celebration of intelligent scientific approach to pesticide regulation in these two areas, and therefore that's something I would celebrate in the UK's regulatory approach.
No, that's entirely fair enough. And I guess you'd probably say that, I guess financial interests, would you say that financial interests play a large role in kind of choosing one approach, the risk versus the hazard-based?
Well, for sure, because if your hazard approach means you ban a pesticide, you can't sell it anymore, and it's black and white. If there's a risk-based approach, you can always argue, well, we can sell our products, and you just have to use it carefully. And I'm sure they're going to use it safely, and I'm going to train them, and they're really going to use it safely. Therefore, it's safe for me to sell my product, would be the perspective of the seller. So clearly, there's a financial push to have a risk-based approach rather than a hazard-based approach.
So I guess on that basis, then, I guess we want to just tie this back to, first of all, your own kind of interest in and how this kind of developed. But also, what I very much like to talk about is how to, I guess, consider all of these things in terms of the future. Because especially with our sort of organization, with UK Youth for Nature, we've been campaigning to have, from our wild streets perspective, we're trying to get, for example, over 100 spray-free streets, activating people across the UK to work with councillors to call for spray-free streets. Simple things like that, stopping spray on the curbside for perceived weeds, because of course there is some biodiversity benefits of having these plants there. They're just, if they're so what if they're unsightly, they have some practical benefit within the ecosystem, right? And what we've been able to do is run urban nature days in Bristol, our attendees sending letters to councillors, MPs, asking them to back urban pesticides bans. And we're I guess in terms of our objectives, we're trying to kind of get 50% reduction in pesticide use by 2030, improving field margins, riverside ecosystems, increasing the number of voices, especially for water campaigns. Because and one point of this, I suppose, which came up in Spring Watch, I'm not sure if you watched it, but so I think it's the University of Sussex who did some excellent work on this, and they found that essentially because people use lots of tickercides on their dogs and their pets, these were not only extremely neurotoxic to the insects, but long-lasting. And so not only were 99% of rivers polluted as a result of this, but the scale of the devastation of the ecosystems was quite marked, and I guess unexpectedly high. So given this context of kind of not only activism from groups such as ourselves, but the actual context in which we're working, let's address this in two parts. First of all, from a human perspective, just very, very simply, if you, I guess, if you can summarize it simply, what would be the effects of kind of pesticides on health? I mean, if we were to be exposed in a general context to a high volume of pesticides. Let's say a farmer was, just having a passive exposure for a long time versus say the active exposure with say a suicide. What
Mhm.
would the impacts be?
I think it's slightly hard to know precisely. The nice thing about acute poisoning was two
Mm,
things. A, you
mm,
know what's happened. The person drinks a bottle, something happens 20 minutes later, you've got a pretty good idea it was a bottle linking with that. So it's very easy to link the exposure with the consequences.
right, right,
And
okay.
also, the other reason I did that was everyone was ignoring it because everybody said, well, that's their fault. The person made the choice to drink the bottle, therefore I'm not doing anything about it. It's their fault. We'll ignore the self-harm. We'll focus only on the farmers who are innocent,
Mm,
contaminated by these pesticides. That was the reason why I went into it. Chronic exposure is much more difficult.
mm,
Clearly, every day we're exposed to thousands of chemicals in the
mm,
food, in the air, in the water, in the just walking down the street. Some of
mm,
those are pesticides, some of them are others. Um, Most of the regulation is based on animal studies. You take an average rat or a mouse and you expose it to these 3 or 4 doses of pesticide in their food over a long period of time, and you look for levels of cancer, etc.
mm.
But that's a single compound. It's hard to know what the interactions will be between the compounds we already have out there and new compounds being going. The U.S. National Institute of Environment, I think, and Health, and IEHS, has recognized for the last 20 years that we really need to understand better mixtures, the consequences of this constant exposure to different mixtures. But I don't think it's gone very far.
Multivariable analysis, right, is always going to be that much more complex than uni.
Well, but multi-exposure, multi-variables you can look at. It's multi-exposures. You say you get 3 years of exposure with this pesticide, then 15 years of exposure to this one, plus
Mm,
75 other chemicals on a daily basis. How do they all interact together? I mean, it's a nightmare consequence of it all.
of
What
course.
we, what overall, there is a belief that pesticides, chronic exposure to pesticides, cause cancers, cause neurological diseases, cause
Mm,
respiratory diseases. I kind of feel it's quite difficult to be absolutely black and white about that because it's very hard to link that exposure through to the consequence. We do things like case control studies. You go and find 50 people with Parkinson's and you say, did you used to say paraquat? Did you used to spray paraquat? And there's clearly studies that show that linkage, but you've got Parkinson's. You have read somewhere that Parkinson's is caused by paraquat, and then someone says, did you use paraquat? Immediately you say, yes, I did. It's called a recall bias. It's a very obvious difficulty. So you
mm,
need those kind of mechanistic studies that show that yes, paraquat can cause Parkinson's. And
mm,
also some scientists are not completely objective. They have a view one way or the other. And that will mean their interpretation of the data or how they design the studies is set up in a certain way. So it's tricky to be clear what pesticides cause in the long term. But clearly, putting a chemical out there which kills things
mm.
is by definition not a chemical you really want to be exposed to. So any possible way of reducing that exposure has to be good, just on a base and a common sense basis, whatever that means. And that's the kind of precautionary principle to say we don't know what these things do in bulk, in scale, and over time in combination with all the other chemicals around us. So it's in the past, it was like, well, if you can't prove a problem, we'll allow it to happen. The precautionary principles turn the other way around and say, well, looking mechanistically, can you reassure me there's very unlikely to be a problem with this chemical you want to introduce into agriculture or into
Mm.
chemical factories, etc.? So the precautionary principle has resulted in lots of chemicals being banned in Europe. And that's, again, this idea that hazardous compounds are being excluded. Do I know what exposure to pesticides will do chronically? No. But I would like to keep my exposure to pesticides as little as possible because they're designed to kill.
And I suppose it's as simple as that. We just need to be careful with it's in as familiar a topic as it might be. The true familiarity is actually rather hazy. And so we have to be
Mm.
careful about what we're using, especially with the increased awareness of biodiversity loss and we're facing as a result of these. And it's especially interesting for you to say that pesticides actually kind of increase the sense, well, the tastiness of certain things for certain bugs, which is
That's what
absolutely
I'm told by colleagues. But one of the
it,
nice things in Edinburgh at the moment is that
mm,
I think the financial crisis has caused them to stop spraying pesticides. So I
mm,
noticed that the base of my wall is huge numbers of weeds there at the moment, which are going to have to go, I'm afraid, because they're going to pull out the wall. But it looks like there's much less spraying on the streets. I have a
Hmm.
colleague who's on the council around Bristol. I don't think he's Bristol Council. He's another council nearby, and they're talking there about removing glyphosate from agriculture, from the use in the community. So one of the things we do in our group is try to find alternatives to write papers. Say, okay, if you're going to remove paraquat, what are the alternative approaches you can use, which are either chemicals or non-chemicals? So
Hmm.
that's really useful for regulators, because when regulators want to remove a pesticide, the discussion is, well, what do I replace it with? To some extent, with time, you probably don't need a pesticide, but that interval, once you stop the pesticide, is quite difficult to change both behaviors and also the ecosystem that's been damaged by years of pesticides. So I mean, I don't know enough about that to know how quickly you can truly move to non-pesticides. Though Andhra Pradesh is making a very good go of it. They're trying over 5 years to change 6 or 7 million farmers' habits away from chemical heavy to no chemical agriculture.
It's Andhra
And
Pradesh in India. Yes, yes.
I
Oh,
was
nice.
there a couple of weeks ago, and it was really remarkable looking at the design they're doing. They're doing multi-cropping. They call it all anytime money cropping. So you have 21 different plants, which are
Hmm.
constantly coming through at different times. You go to the market every 2 weeks, rather than monocropping, you go twice a year. There's lots of exciting things going on there. So maybe you can do it quickly.
Sure. I mean, there's so many new things to consider. I mean, and especially all of this stuff being done in Asia in particular, seems like it's having a knock-on effect kind of around the world. But that being said, um, obviously, I know a lot of your research has been done in Asia. What would you say kind of the most trend? And I obviously the way the regulations work kind of does kind of change the access to pesticides, for example, that your regular household would have, versus the population even using it to start with versus kind of your sort of general sort of subsistence farmers, I guess, versus somebody who's kind of conducting agriculture at scale, as you might get here.
Yeah.
So on that basis, then, if there were any sort of transferable lessons that we could actually really take from the work that's been done, across the world, to the UK, for argument's sake, especially since we as an organization are based here and most of our listeners are based here, what
Hmm.
kind of transferable lessons would you say the UK can take from all of this kind of extensive work done abroad?
I mean, I'm a clinician, remember? I'm not an
Yeah,
agriculture.
yeah, sure,
I'm
sure, sure.
not,
No,
I'm not an agriculture.
even from a health perspective, even from a health perspective.
Well, we know the regulation works, and I think there's been remarkable data coming out of China and Sri Lanka showing that high quality regulation makes a huge difference and
Mm,
actually has health benefits. We can't yet know the long-term chronic benefits of reducing pesticide use, but acutely it's really very obvious. Reduced healthcare costs, many lives saved, no effect on agriculture. And China's been remarkable. They've gone from 180,000 deaths a year down to 10 or 20,000 deaths a year. So the data is very clear from those countries. The issue is that the readout here in the UK is so much smaller because relatively few people use pesticides, especially
mm,
agricultural pesticides. So those stories are understandable and very dramatic, but probably not highly relevant. The the move in parts of Asia to away from monocropping towards multiple crops and
mm,
trying to reduce pesticide use by encouraging natural predators, by planting particular plants amongst the crops to attract different insects is a really interesting thing. So if you look in Vietnam and the rice fields, colleagues of mine have been doing studies where they put different plants there. In
mm,
some cultures, they put plants which I think marigolds are a plant which help to deter insects,
mm.
while others in Vietnam they're trying to put flowering plants which encourage insects. And so there's a different way of planting things, which I think the UK is moving towards more integrated pest management. You hear about rewilding going on. Our
Yes, yeah.
farmers are moving away from just a simple large scale monocrop. So I don't know how much that message is passing backwards and forwards between the continents, between the different styles of farming, but definitely
Mm.
the processes are happening either in parallel or hopefully talking to each other.
It would be certainly very interesting to see kind of the results of, say, rewilding efforts such as at NEP rewilding, which I'm sure many of our listeners have heard of, where nature has essentially been on a farm sort of environment, left to manage by itself. And since then, the results of biodiversity have been very, very interesting. I mean, people often talk about, I guess, what you often talk about is you hear about the yield and stuff being less, but I guess we'll have to wait and see in terms of the research and see how rewilding efforts are doing kind of across the world, really. Because you
Mm,
can, like, you see, what's a good example of this? Almond farming, for example, in California. Dramatic swathes of the landscape are going to be taken for, this monoculture to the point where the bees themselves get sick, so they have to keep fishing in bees from like other places. And so ultimately, it's an unsustainable model in that sense, and
hmm
it's being demonstrated. So it'd be very interesting to see the health benefits and see if they actually kind of correlate with the behavioral and practical changes that are actually happening in farming and see if they can be scaled up, I suppose, in the coming years.
I mean,
I
there are interesting studies out of the States. I mean, there's the US farm study looking at pesticide exposures on farmers and coming up with correlations between pesticide use and particular illnesses, suggesting
right.
that there are illnesses going on there. So something else I'm going to say now, I've forgotten it. You go. You go ahead. I'll come back to mine. I'll
No
remember it
worries,
soon.
no worries, no worries. But we can certainly come back to that. But what I actually might ask as well is for our listeners and especially people coming to the YouTube webinar a bit later, if we can have a list of some of these very interesting papers, what we can do is try and summarize them as best we can, and then we can present them to the people kind of watching. And I think that'd be very, very useful to understand the context. Not everyone is, of course, going to be an academic. But then again, I don't think you necessarily have to be to kind of understand these broader gists, right? I think
Absolutely.
what we've seen, I think what I've managed to take from this conversation, and thank you very, very much for this very, very detailed conversation that's gone from academia to, how we're providing the best possible health advice for regulators who can then provide it to politicians to make decisions. It's a question of narrative. I think at the end of the day, like so much of this is a question of narrative and like what stories are being told about pesticides wherever. And I think there is definitely a disconnect in that regard because I think in many ways that the politically or the socially, what's it called? The way that the story can be told to people must necessarily miss things out. And some of these
Mm-hmm.
nuances that we've kind of been discussing already, which has been super, super interesting in so many different ways. It's hard to communicate that, I guess, in a way that's kind of malleable and accessible to the
Mm-hmm.
public. So I guess in terms of communication regarding pesticides and health or however you want to do it, actually, I think because our organization is very much about that communication. What kind of narratives would you, I guess, like to see as a health expert on, pesticide use going forward? Given that there are so many developments happening all over the world in terms of farming changes, in terms of the way pesticides are being understood, and how ultimately they're being used. What kind of narrative do you think we could see more of or provide more of to help people understand things a bit better?
Well, I think the fundamental narrative is to counter the comment that pesticides are essential for agriculture. And you see that everywhere. Whenever a medic writes a paper, they want to write
Mm,
a paper about a problem. So someone's dying from a particular pesticide. They will always start that pesticides are essential for agriculture. So, well, let's explore
says
that a
who?
little bit because there's almost never a citation there. So I think a
Mm,
lot of the stories we have to explore is about really, are they essential? Is there any evidence that we need to keep using pesticides and forget about the last 6 years? Do we have to keep using pesticides now to sustain our agricultural output? And
mm,
also to remember that starvation is often not about agricultural output, it's about distribution and affordability. If people can't afford food, then they suffer. If the
mm,
food's not available, they suffer. And that is often not due to a production because we have excess food all around the world. I grew up as a child knowing about butter mountains, wine mountains, and all these mountains of food which were overproduced,
mm,
but were not distributed for cost, for economic reasons, I guess. But I also have worked in places where people can't afford to buy really good food. The food you would like people to eat. It's not that it's not being produced; they can't afford it. So
mm,
I think we talk about if we lose 10 or 20% of the agricultural output because we move to organic, which I don't think is necessary, but say we were, the hypothetical, the argument is that will cause famine. But actually, that's probably not true. We probably waste 50% of our food at the moment, but from the table for a start, and
mm,
also from our distribution systems and food that goes to waste. I know there's all the issues of meat production. We produce too much meat, probably. And so we're taking land out to produce food for meat, which we then eat, which is a
mm,
very ineffective way. So a lot of the stories has to be about countering this, of actually coming together with a more skeptical view about pesticides and acknowledging that the story we hear is very much driven by an industry, which is there to make sales and to provide profit for their shareholders, as any other company should do. So that is a fairly key one. I
mm,
think, the story that glyphosate causes lymphoma is tricky. I mean, the data is from a few mouse studies.
mm,
And if you look at two different organizations, one using data provided by industry, they said it wasn't cancerous, and one providing data from the gray literature as well. So not only
mm,
the industry stuff submitted to the regulators, but the other literature, they said it was. But it wasn't based on lots and lots of studies and clearly black and white. Yes, this causes lymphoma. The data is always a little unclear. And so I guess the other thing we have to say is, do we want to spend the money to get the studies done to understand which pesticides we really need, or are we willing to continue to rely on the industry to do the
Mm,
studies and provide us with these studies? And we know from the healthcare industry that studies were hidden that didn't produce the right results. That's why healthcare studies are now registered, so you can't hide studies anymore. That system is not in place for agricultural studies, and we have no idea that the data coming to regulators is all the data that's been produced. And
mm.
one would read the exposés, which would suggest that probably isn't the case, that there are studies like in the healthcare system that were not given to regulators. So there's a number of different stories to take out there. Do we need pesticides? What are the chronic effects of pesticides? Should we be taking over the testing of pesticides to
Mm.
actually work out what's going on? But pharmaceutical industries do most of the studies, but now they're very much more regulated. All the studies are registered, and therefore it's easier to understand which studies have been done. My view is that the studies being done in agriculture are not as thorough as the ones being done in health and in public health policy.
That is absolutely, that is very, very fascinating to hear. It's not all that surprising. Well, you see movies like Michael Clayton, which kind of just make everything seem so and Dark Water and things like that about kind of the stories of how various kind of companies have had underhanded agendas, I suppose, about these. And then, various different things have kind of cropped up in the background to kind of come to light, especially when people have been harmed as a result of all of these things. And it's just a shame that the stories only ever seem to come about when someone has had some sort of end stage problem happen to them, which is a real
Yeah,
shame. But it just comes back to this idea of efficient storytelling and choosing which narratives to actually prioritize. And in terms of certainly improving awareness about what specifically is actually happening within this realm. And I think, we've had such an excellent conversation delving into, the ins and outs and nuances of all of this. Um, I guess for one thing I did want to just ask, just to clarify, one thing we're working with in UK Youth for Nature is we're working with ChemTrust in 2025 to call for a total ban on per and polyfluoroalkyl substances, so PFAS, right, for
mm-hmm.
our listeners. And we're going to try and host a parliamentary reception calling on our MPs to support a ban. Now, in terms of PFAS, would you say PFAS? I mean, we're commonly referred to as forever chemicals, right? Would do PFAS substances tend to be used as pesticides, just for absolute clarity? And what kind of work has been done from your perspective to see kind of their impact on health, if that's been part of your kind of remit in terms of looking after them?
It hasn't.
Okay.
I don't believe PFAS. I mean, so PFAS are a certain number of chemicals which are not used as pesticides, as far as I'm aware.
Hmm.
There are persistent organic pollutants, for
Hmm.
example, endosulfan, endrin, many of the organochlorines, DDT, are the
Hmm.
classic examples of very long-lasting chemicals. So they're also forever pesticides, but I
Hmm.
don't think you would describe them as PFAS. I think those are different chemical structures.
Sure.
And the Stockholm Convention has done a pretty good job of removing those. Many of the countries I see, something like 2002, you'll find 8 pesticides all being banned, and they're all the organochlorines. So there's relatively few organochlorines left. One of the advantages perceived of the organophosphorus compounds is that they are not as long lasting in the environment. They break down very quickly. That was one of the reasons for the shift from organochlorines to organophosphorus compounds. And that Stockholm Convention, I think, has been pretty effective. The Rotterdam, much, much less so. Stockholm is much better.
When did Stockholm come about?
Mm,
Take a time.
2000 or so, I don't know.
Okay, fine, no worries. That's somewhere around that sort of time period. But essentially, over the last sort of 20 years, regulation has definitely increased. Well, understanding certainly has too. But of course, there are still, with changing behaviors and attitudes surrounding kind of farming and appreciation of biodiversity loss, things, of course, are shifting and changing and developing. Um,
Slowly,
and
far, far too slowly.
I know it's always far too slowly when you see sort of the things around you, but because behaviors are so entrenched,
Yep.
it's often very difficult to change. But I guess on a final note here, I mean, and this has been a very, very, very interesting conversation. I did not expect some of the things to be so kind of mind blowing in terms of the revelations that you've been able to provide as Professor Eddleston. And we talked about pretty much your own kind of interest in toxicology for starters. In terms of how you've designed trials and run all of this work in Sri Lanka and worked in terms of providing health advice to regulators here in the UK. And this is a wonderful wide-ranging body of work, and we really look forward to hearing the results of that summation of pesticides from that colleague at Bayer that you mentioned, just because it'd be very interesting to see what justifications come out of that and how we can design or come up with narratives to better communicate reality. I think that's something that's fair to say. But I guess on a final note, I think if we were going to leave our audience with kind of one bit of advice or one bit of awareness surrounding pesticides, their impact on health, and I guess the future, what would your kind of last sort of passing comments based on your vast body of work actually be, especially in terms of getting the public kind of more aware on the true nature and reality of pesticide use?
I mean, the simple I'd say is go organic would be a choice in your shopping. It's a precautionary measure. It costs you more money. It rewards farmers who are more careful with their environment they use. I think we need farmers to produce food. We need to work with farmers, and we need to support them. We need to pay them. And again, I'm not an expert. There's so many areas I see on passing. What I'm good at is a clinician caring for patients poisoned by a patient. I do good studies, but I'm surrounded by all these other aspects, and I pick up little things. I'm not someone who knows all about these different elements.
Of course.
But it seems to me, go organic, reward farmers who are careful with their land, try to find a way of bringing our land back from monoculture into multiculture, and be careful with your food. Don't throw so much away.
And I think these are excellent points. One thing I will say, just on the topic of Sri Lanka, actually, I remember very distinctly that the previous regime, well, two regimes ago now, I suppose you could say, they tried to make the country go completely organic. And
okay, so I'll answer that before you go on. So that wasn't quite true. So there was clearly a major philosophical view by that regime to be organic. And I think that was definitely philosophically where they were going. It's partly about back to nature. It's partly not anti-West exactly, but it's about coming back to where we are. It's very similar to Modi, about India being able to be sustainable and self-sustain. The same thing is similar to Sri Lanka. The problem was, and he'd also done some really nice work on nitrogen. They're trying to reduce the nitrogen damage to the environment in Sri Lanka. So there are definitely good things in the background of this. But what seemed to happen, for what I understand, is there were ships coming from China full of chemicals, and Sri Lanka had no money to pay for them. So what they did almost overnight was make the country organic, and those ships turned around and went back to China. And so it wasn't so. But actually, if you look at that time point, there was pesticides in the country left, about 9 months worth of pesticides. And there was something like 5 months of fertilizer left in the country. So there was no immediate shortage at all. But the problem was the president had come out and said, we are going organic, as the presentation of this decision, which was probably much more financial, but still did meet some of their philosophical approaches, which I agree with. But then you had the farmers going, well, what the heck am I supposed to do? I'm going to plant my crops in the next few months. I've got 2 seasons coming up. What am I supposed to do? You just told me I can't use pesticides. And also the vendors suddenly thought, I'm never going to be able to buy any more pesticides anymore. I got pesticides anymore. I'm going to put the price up. So the price went up massively. So you had farmers who then made the decision to stop planting because they didn't know what to do. And you had people who walked off and did other things because of uncertainty. So then we have a story that, agricultural output fell by 40% in Sri Lanka because they went organic. That wasn't the case at all. It fell 40% because the farmers had no security about what was going to happen over the next year.
Wow.
So that's what happened as a result of that ban. It was nothing to do with going organic. Clearly, going organic overnight is probably not the best way to go organic. And Andhra Pradesh, for example, is doing it over 5 years, working with farmers, supporting them, moving outwards. So the story has been used by industry and by people who are pro-pesticide to say, look at Sri Lanka, complete disaster. We actually, where all the regulation has been done carefully, there's never been any effect on agricultural outputs. And again, it's not the output that's the problem, it's the distribution and affordability.
Yeah, absolutely. And I think just it's access and understanding kind of the role of farmers and remunerating them fairly, I guess, for their produce, of course, versus kind of cutting, the payment at that level just to price gouge at the other end. It's
but that's the thing. If you look at government policy as well, you could either force farmers to make cheap food which poor people can afford, or you get rid of poor people by increasing their income. So if you, instead of putting, if you could actually allow people to have enough income to buy good food, you could massively change the diet in Britain, and you could make farmers more successful. The question is how you get more money into the hands of people to then allow them to buy good quality food. So I don't mean get rid of poor people as in terms of get rid of that group, but to make them not poor by giving them more money and allowing them to make that would make the difference. So, minimum income, would actually help farmers because people would be buying, would be willing to spend more. In theory, I don't know whether studies have been done to show this, but people would have the ability to spend more money on good quality food and allow farmers to do good quality farming.
And what a dream! And I'm sure that that work is being done to kind of do this. And obviously, what a dream it would be to kind of get people to a more sort of equitable state where they can actually do this. For sure,
Absolutely.
absolutely for sure. And on that kind of really hopeful note for the future, thank you so much for this talk, Professor Eddleston. Um, it's been such a wide-ranging conversation. I'm going to have to go back through this with a fine-tooth comb to kind of find just the details to even summarize some of these, because some of these insights have been not only surprising but extremely valuable, and not just in terms of the pure information themselves, but their value in terms of creating a broader narrative for what we really need to hear surrounding pesticides. Now, I'm going to move kind of some questions to the floor here. If anybody who's been listening to this chat, and obviously thank you so much, guys, for listening. And obviously, if you're listening or you're watching the YouTube webinar, feel free to drop some comments or follow us on UK Youth for Nature on our various socials, such as Instagram and Twitter, just to make sure that and ask us any questions you like about this. I'm sure I'll be able to
I
forward
presume
some.
you're coming off Twitter fairly soon.
Oh yes, we're moving to blue sky. Ah yes, I see what you did there. But I certainly I've actually made that move today. Funny, it's funny you mentioned that actually,
It has
Professor.
to happen. I'm sorry. You just can't, we can't stay on X anymore. Anyway,
Agreed.
excuse me.
Agreed. The ether the for a question of ethos, absolutely. I entirely see what you mean. See the light, go blue sky. But in all seriousness, um, if the floor has any questions, I'd be more than happy to take them. Um, and obviously, if there's any questions that come up in the chat or later on, I can pass them on, and I'm sure that we can
Please
get
do.
some of them answered. So let's give a couple of minutes just to see if there's any further questions from the floor and from any of our participants. And if not, we can probably just end the chat and end the call here. So if anyone wants to answer any questions, feel free to unmute yourself and ask, or just drop something in the chat, and I can ask for you. Yeah, I do think that as a talk, I think we've covered a lot of ground here, and I think we'll even just as a committee, we're gonna have to kind of pick through some of these bits just to see just how valuable these bits are. And of course, I'll send you the video afterwards so that you can pick the choicest bits. It's been very very as a clinician, it's been eye-opening. We're just taught the organophosphates do X, Y, and Z. This is how you treat it, but
Hmm.
there's so much kind of that you miss simply by breaking it down to its bare bones. But there's so much sort of flesh that we've kind of been able to touch on today. And I suspect the chat is probably kind of in the same position I am. We probably do need to have a good long think about all of this stuff. But honestly, in all seriousness, thank you so much, Professor Eddleston,
No
for your
problem.
time today. It's been super valuable, and thank you so much for committing your time. I know you have your concert with your daughter to go to, so I will not delay you any further. Thank you so much for your time.
No
And
problem.
guys, feel free to kind of follow us on UK Youth for Nature in due course. We'll be posting this video onto YouTube and across Instagram in due course. Thanks very much. Have a great evening and all the best. Thank you so much, Professor. An
Bye bye.
absolute
Thanks for your time.
no worries, no worries.